Hi, my name is Iradukunda Electronic. I'm going to talk about electronic health record. First, I'm going to introduce about electronic health record and its function. So, electronic health record is an automated papers online medical record for which patient medical data is entered by eligible providers such as nurses and physicians. So the function of electronic health records is that it helps physicians practice better medicine and also improving the bottom line. So also it identify and maintain a patient record. So after understanding introduction about electronic health record and its function, so I'm going to describe two components of electronic health records that directory clinic cares and also explaining benefit and issues. So about two components of electronic record that support direct clinic cares. So is that there is a clinical component and also a laboratory component. So about the first one, which is called clinical component. So this has a multiple subcomponent like computerized providers order entry. So this also there is electronic documentation and others. So those are the component of a clinical component, which was a component of electronic health record. So this component really make use of clinical decision support tools in electronic health record like drug and drug allergy and drug diagnosis interaction. So about the second component of electronic record, so it is a laboratory component. So this component it is used to integrated with the electronic health record or existing as a standard loan product. So this was about two components of electronic record that support direct clinical cares. So also there is benefits. So the benefits of those it's to improve patient cares. Of course, if they are using electronic health record, means they are using technologies, and these improve patient cares. Also increase patient participation. Also it improve care coordination while delivering services to health. So uh, after understanding about the benefit, also there is some issues. So the different patients are fearing about the integrity and the privacy of their health information. So the second one is about describing two components of electronic health record. So that support administrative process. So those two components are patient managed component and also billing system. So about the first one, which is called a patient management component. So this require for patient registration, means it is in charge of organizing patient information like insurance information and others information which is related to patients. So the second one, which is called a billing system. So this is used to capture all charges generated in the process of taking care of patients. So those was about two components of electronic health record that support administration process. So after those, there is benefit to electronic health record. So the benefit is that they are improving diagnostic. So another benefit is that there is improved patient outcomes. So another benefit is practice efficient and cost saving. So after understanding benefits of those two components, also there is issues which comes on their while they are working delivering different services. So because of using technologies without internet, electronic health record cannot works. So also while using technologies, of course you can meet with different interruption where you can be interrupted with maybe using your internet in other things. So those was about issues. So after that there is importance of the integration of administration. So the there are many importance about integration of administration. So some of those are integrated decision making, safety analysis, also accessibilities, timelines, accuracy and integrities. Of course it can make accuracy and integrities, reduce the duplication, also greater accountabilities. Another important is about faster processing and turnaround time. So after understanding the importance of the integration of administration, also there is a clinical areas for effective use of an electronic health record. So after making a research, so I found that there is many clinical areas for effective use of an electronic health record. But some of them are. So the first one is about developing personal qualities. So this you need to show your professionalism while working. Also there is working with others. You need to develop networking. Of course if you are working you need to develop your networking while sharing your contacts and asking contacts to the people you are working together. So also there is improving services. So for this they're improving healthcare processes. Another one is about managing services. So for this if you are working on clinical areas, so while using electronic health record, you need of course improving health cares while taking care of patients as it can be without interrupted with your phone and others. So this can show people that you are improving healthcare processes by giving care which is needed to the patient. Also there is managing services. For this you need to know how to manage different resources. Of course if you have resources, you don't need to take some people giving more resources which they are not required to have. You need to use it professionally and effectively as the way of managing different resources in that services. Also there is settings direction. So for this after making a research I found that while setting direction you need to identify opportunities for change while applying your knowledge. Now, of course if you have any knowledge about something, you need to apply it by showing that I can do this on my own without having fears, not having a complaint. So this will help you to setting a direction in what you are doing. As you know, these electronic health record need more technologies. For instance, you can know you have a skills of typing. After at that time, if you use your skills effectively, typing information about patient as it is, so this will be helpful for you while applying that skills. So it means you are able to work on clinical areas. You are able to work on electronic health records while applying your skills. So I found that this is the end of my presentation. So thank you.